Um, I think we'll move on to the next speaker and hold questions for the end.
I can hold this for now. Hi, my name is Greg Wellems, and I am not an elite athlete. And if you, Dr. Coughlin, if you do come up with some sort of treatment for my 5-head, I'll give you my card later. And Jeff, I could really use those shoes because back in Colorado, I understand I'm getting 10 inches of snow today. So I'm actually very glad to be here. Got it? Are we good? We lose a clip? Okay. Well, if I step on it, yeah, I'll hold it for now. Great. So a little bit about the organization I work for. It's a private not-for-profit located in Boulder, Colorado. And I think my role here today in talking with this group is representing service provision. The service providers that are out there, we've already heard from an end user and Steve and his great and the great work that's going on with the ALS home. But what are service providers? What's the nature of service provision out there? We're a private not-for-profit organization, and I think one of the key points in this slide right here, I'm going to trade microphones, oh great, is that 85% funded by Medicaid. As you know, to qualify for Medicaid, you have to have assets and resources that are less than $2,000. So my organization supports people that are on Medicaid. So we have developed and invested in technology because when you're on Medicaid and you understand the services that are provided in Medicaid and Medicare, you understand that there are sustainability issues. We've heard about workforce crisis. You already know that in the next 15 years, you look at the DOL website, the #1 in-demand jobs will be in healthcare. We recognize those situations. We also recognize that there are wait lists, and those wait lists are growing related to those sustainability issues. So with all those kind of factors, what we decided to do, and we decided this about 15 years ago, is, well, we need to get in, technology has to be part of the answer or part of the equation for the answer for future services. And what we needed to do then is we tried it in bits and pieces, but we needed to have a coordinated aspect. We needed to have a coordinated service. We needed to have a place where we could test this. And I went all over the country at this point, and I went to the Georgia Tech, and I went to Duke, and I went up to Oregon, and I went to California, anything that I could find with a smart home, a smart lab, smart service. And it was great what was going on in the research setting, but these were basically college students pretending to have a disability. They were college students that were part of a class. They were part of a project. There was something that was doing end. So we needed to have a place where we could actually have people living there, people with cognitive and developmental disabilities, that we could try technologies. We could figure out what worked. We could find out how we needed to adapt and change. And we developed a very strategic process in this. And when I talk with service providers throughout the country, I tell them you have to have a strategic process. You have to look at education. You have to look at prioritization. And analyzing pain points, pain in this point is not a physiological term. It's an organizational term. And if you want to understand an organization or service provider's pain points, all you have to do is walk through the building, and I think it was referred to as a 6-inch binder this morning. That's a pain point. That is static information, and we needed dynamic information. And you have to plan for a cultural change. Technology represents a cultural change, and you have to understand that, how that's going to impact service provision, the caregivers, the caregiver dynamics, and you have to plan for that. You have to support organizations to do that. Providers in the country, they throw technology at problems. So it's a learning management system. We have online learning systems, and we throw that at a problem. We have an enterprise application. We have an HR system. We have those kind of systems that's designed to for a specific issue or problem. We have an individual that's living there that needs a communication device, that needs an environmental control system. We have a remote monitoring system for this individual basis, this individual problem. What we were trying to do was look at it and say, how do we tie all these together? How do we tie these smart homes, so enterprise applications, remote monitoring applications, cognitive support technologies, in this case assistive or adaptive technologies, how do they all interrelate, how do they work together, and how do we get that information moving so it's not just an individual solution. It was a total organization. Now, our goal on all of this is not to develop smart home after smart home after smart home. We understand that there are families out there waiting. We understand that there are individuals that necessarily won't get into the Medicaid club at some point, and they're going to need supports. So how do we take what we're learning here and what we're moving to at some point is these smart homes will develop the technologies that we're learning about, that we're helping to support and develop, will eventually go to that end user and will fit in this smart homes, which will go to a smart supports kind of concept. So I'm not going to get too much into our environmental design, but we did a universal design kind of and everybody understands that concept. But universal design now has to include technology and how technology is designed into homes. And very simply, that you put a outlet near the top of a door, so at some point you can have an automatic door opener. You reinforce a ceiling when you build a home or you're putting in a new home, so it can have a barrier, it can accommodate a barrier-free lift. You build a wall and you reinforce it with some particle board or plywood, so at some point you can add a monitor or a remote robotic arm at some point. These are simple solutions and cabling solutions. So universal as design, and some of what we heard from Steve and his designs of his home, the knowledge that he has as the end user, you have to include. Accessible work areas, home automation of what you heard, PLC panels, control panels. These are basically programmable logic control systems that will allow you complete access to any sort of outlet or device that's in the home. So somebody can automatically open and close their doors. They can automatically open and close their blinds. They can turn on their televisions. They can turn on their radios. Whatever they need to do, countertops that will adjust to their needs. That's what we're looking at. And one of the things that we did, because you don't build a home in Boulder, Colorado, unless it's green. If you want to raise money, and we were about raising money for this project, this is all privately funded and grant-funded homes. You make sure that it's energy efficient. And one of the areas we're looking at, and I can talk about in the future, is how energy efficiency monitoring and what's coming through the use of the smart grids, how you can use that in some of the remote monitoring applications in the future, because these are basically home control systems. So we have PV solar, we have hot water, and we have geothermal in the home. Just a quick little picture of right before some people moved in. And I just wanted to do this because here's some quick examples of before the countertops go in, the kind of infrastructure that you have to put in for adjustable countertop, adjustable sink. And in this case, I think we have Anthony that's using his, it's just an adjustable cooktop with an induction stove. So inductions 4 years ago was coming onto the market. Now it's much more prevalent and you can pretty much get it anywhere. And here's an example of some of those technology infrastructure. Mandy here is using a touch screen that's connected to her wall in her room, in her computer, that she's basically uses every day and for her needs. So breaking back to that original screen of environmental applications, how we're tying in, and some of the information that we heard earlier about data. You just can't present another email. Data has to also be presented to organizations in a user-friendly environment. So we're big on dashboards. So we can capture trends, we can capture analysis. You can't just send data, you have to send it in such a way that it's meaningful for the end user. So we use a very customizable system to get a dashboard in place. So whether it's instant report trends, whether we've tried our CRM process, our customer relationship management process, into our financials, all that has to be given in such a way so it's meaningful to whomever that is, whether that's a business person, whether that's a direct care supporter, or even an end user. It has to be done in a way that that data is meaningful. So we used an RFID system. This was what we wanted to be the backbone of our homes. You've heard a little bit about RFID today. It can be used as an environmental control system. A badge can automatically open doors. It can be used as an alert system, such as a nurse call or a caregiver call system. It can also be used to notify managers. It can be used as a time tracking system for direct care staff. It can also use, what we had intended is it could also be used to understand how care needs change over time. So we had hoped to use it to judge the amount of time a caregiver was spending with a person in services, a person who needed supports, how long they were there, and how those time changed, how long that care needs changed over time. So that was our intention. It's been tabled, and I'll talk a little bit about why that in background. The other thing that we're big on this is an EMAR, electronic medical administration record. Prompting systems and notification systems are a huge thing in the industry right now. They weren't very prevalent 4 and 5 years ago. They're becoming much more prevalent now. By prevalent, I probably mean that there's 4 or 5% of the caregivers, service provider organizations that are actually using it, but that's probably a 300% increase in the last 3 years. And then environmental control systems. These are also devices that we're testing and using now. One of the things we're getting away from is that PLC control panel, because we're finding tablet devices, and the cost of these tablet devices are decreasing. They're becoming much more affordable. They're becoming far more flexible. So some of this technology is evolving, and the things that we're doing right now, as far as some of our other services, are working very well. And they can run off head scanners, or they can work off voice activators, or in this case, here's an example of someone using a button switch in order to control their environment. So the other area, I talked a little bit about our enterprise applications. We have a number of remote monitoring systems in homes, motion sensors, we have proximity sensors, door sensors, contact sensors. A little bit today, I'm sure that Dr. Alwyn has it. You know, there are systems in place that they put in motion sensors in the bathroom. If someone is at risk of a fall, that motion sensor will detect a specific area. If someone falls down, it can alert a caregiver in those kind of areas. Remote monitoring systems also include GPS devices and community navigation systems. And then all these systems, what we were doing is, and what we've done with these smart homes is understand that we have to track trends. Remote monitoring is becoming much more prominent. Here's a grand care system that basically does blood pressure, biometric monitoring. It also tracks and trends how people move about in their environment. Cognitive support technology needs to work in any environment, whether it's in the community. These are assistive and adaptive technologies for the end user. We like this system because it looks the same and feels the same on whatever device they're using, whether that's a desktop, whether that's a mobile application. This is AbleLink Technologies out of Colorado Springs. And it can be used for prompting, learning, or teaching systems. So it can help somebody through a task. It can help also educate a caregiver from the end user perspective. Here's John, who uses it for his cooking. So lessons learned. We've heard about low-hanging fruit. A key thing for service providers is there's no corporate expertise. IT developments and IT staff are all about managing the network. It's not really about managing the technology that the end user needs. It's not really about managing the remote monitoring system. So building corporate expertise, collaboration is not happening in the service provision world. It's happening in some cases, but providers are looking for more and more. We sell the RFID. We think it's an emerging technology, but it's just been too unreliable. And in our field, we cannot have any technology that is not reliable. It cannot break down, and you have to have backup systems. I passed that very quickly, but social media has been a huge success. We didn't anticipate it. It's redefined community for people with disabilities in such a way. Social media does not recognize a disability, and the people that are using it, we're having great success with it. And finally, I don't like to use the term fail point, but it is a fail point. The caregiver is where this technology oftentimes will have a great caregiver, but the turnover occurs. The new caregiver comes in and doesn't understand the technology, doesn't necessarily understand how to support that technology. So it's vital from a service perspective that we do a better job recruiting, hiring, changing job descriptions, training caregivers, so when they come in, we've actually put in a technology screening in all of our applications, hiring a different kind of caregiver, care support in those areas. So there's my contact information. I encourage you to contact, look at our work, and I think we'll take any questions now.